name's Ashley Jones, and the date is January the 19th, and it is 5 o'clock. All right. All right, and we will begin. So her skin is warm, dry, and intact, without any bruises, rashes, edema, nevi, lesions, or scarring. Her head is normal cephalic, midline, and symmetric. Her scalp is mobile and intact without any sort of masses, infestations, lesions, depressions, or tenderness. And now we will do her lymph nodes, pre-auricle, post-auricle, tonsillar, submandibular, submental, anterior cervical, posterior cervical, occipital. Any tenderness? No lymphadenopathy or tenderness noted. Any tenderness? No. No temporal artery tenderness noted. I'm now palpating her masseter muscle. She clenches her jaw. And now I'm going to have you open and close your jaw. Okay? And close your eyes. And when you feel me touch you, let me know. Now. 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 Okay? So, cranial nerve 5, the trigeminal nerve is intact. Her temporal mandibular joint had no subluxation, crepitus, or tenderness. Now, can you raise your eyebrows, puff out your cheeks, smile, frown, pucker your lips? And cranial nerve 7, the facial nerve, is intact. And light touch sensation is intact as well. We will now do her ears. Her ears are symmetric bilaterally. Any pain? No masses or tenderness noted. I'm now taking a look at the auditory canal and the tympanic membrane. Okay, and they are both within normal limits. I will now do, we will now test cranial nerve 8, the auditory nerve, to check her hearing. So first I'll have you occlude one ear and whisper the word back that I say. Apple. Okay, now on the other side. Apple. Okay, so that was the whisper test and she passes it because she identified both words correctly. Next is the Weber test. Do you hear this equally on both sides? Equally. So she passes the Weber test because no lateralization is reported. Next will be the Wren test. Tell me when you can no longer hear this. Now. Now. Okay. Now. Now. Okay, so air conduction was greater than bone conduction, indicating that she passes the Wren test. So cranial nerve 8, the auditory nerve, is intact. We will now move on to her eyes. Her palpable fissures are normal. The eyelashes curve away from the eye. The eyebrows extend beyond the eye. The sclera is white. The conjunctiva is pink. There's no lesions or discharge. We will now assess cranial nerve 2, which is the optic nerve with visual acuity and central and peripheral vision. If you look at the Snellen eye chart, read the smallest line. Cover one eye and read the smallest line you can see.
D-E-F-P-O-T-E-C.
Okay?
D-E-F-P-O-T-E-C.
Okay, so her vision is 20/20. We will now test her. We'll do the confrontation test. So I'm going to have you cover one eye, and I'll cover the same eye. Now looking at my nose, using your peripheral vision, tell me how many fingers I'm holding up.
2, 1, 2, 1.
Okay, now on the other side.
2, 1, 2, 1.
Okay, so she passes the confrontation test. So cranial nerve 2, the optic nerve, is intact. Next, we'll test cranial nerve 3, which is the oculomotor nerve, cranial nerve 4, which is the trochlear nerve, and cranial nerve 6, which is the abducens nerve, by doing the extraocular movement. So following my finger with just your eye. Okay, so she had conjugate gaze through all 6 fields of gaze, indicating cranial nerve 3, 4, and 6 are all intact. Let's test cranial nerve 3 further. We will do pupillary response to light. And if you look straight at my nose. So her pupils constrict both directly and consensually. Now if you will look at my pen light, and as I move it closer to your face, so And now look at my pen light. Now look at the wall behind you. Now look at the pen light, the wall behind me. Okay, so she also demonstrated appropriate accommodation and convergence, indicating that cranial nerve 3, the oculomotor nerve is intact. We will now move on her nose, which is symmetric and midline in her face. If you can close one side of your, now breathe in and out. Okay, now on the other side. So she displays appropriate nasal patency. I'm now going to have you close your eyes, and we're going to test cranial nerve 1, which is the olfactory nerve. Tell me when you can smell this.
Now.
Okay, so cranial nerve 1, olfactory nerve is intact. Now moving on to her mouth. Her lips are pink and symmetric. I'm going to have you open your mouth and say, ah. Now move your tongue side to side. Okay, you can close your mouth. So her teeth are aligned without any signs of decay. Her tongue is midline pink, moist, without any deformities. Her posterior pharynx, her palate, the floor of the mouth, the buccal mucosa, and the gums are all pink, smooth, moist. Salivary glands are not swollen. The tonsils are not present. Soft palate, rose symmetrically, and the uvula stayed midline with phonation indicating cranial nerve 9, which is the glossopharyngeal nerve, and indicating cranial nerve 10, which is the vagus nerve, are intact. The tongue moves side to side without fasciculations, indicating cranial nerve 12, which is the hypoglossal nerve, is intact as well. Going back to the eyes, I'm going to check her red reflex now. Okay, now on the other eye. Okay, so red reflex was present and the fundus was free of any lesions. Okay, so now we've done your mouth. Now we'll move on to your trachea, which is midline. We'll now do the carotid arteries. So first I will palpate them. Okay, and now I'm listening for any bruise. So no abnormal pulsations or bruise noted. I'm now going to palpate your thyroid. Can you look forward and swallow? Okay. Her thyroid was non-fibrotic without any sort of fibrosis or lesions noted or swelling. I'm now going to move on to your chest. Her chest, anterior and posterior chest wall appear to be atraumatic and without any noted deformities. And now I don't see any sort of respiratory distress, such as tripline tachypnea, cyanosis, accessory muscle use, nasal flaring, retracting. We will now do her expansion of the chest wall. Breathe in, out, okay? Okay, so both anterior and posterior chest wall expansion is symmetric. We'll now move on to percussion. No, tactile firmitus. So every time you feel my hands, if you'll say 99.
99, 99, 99.
Okay.
99, 99, 99.
Okay, so tactile firmitus, vibratory sensation is felt equally throughout the whole chest wall. We're now going to move on to percussion. Okay, resonance to percussion throughout the whole lung field. We'll now do auscultation. Every time you feel my stethoscope, take a deep breath in and out. Okay, now on the side. Okay, and on this side. One on the anterior. Okay, and so she had no adventitious breath sounds, and her breath sounds were clear and equal bilaterally. We're now going to move on to roll consolidation. So every time you feel my stethoscope, if you will say the word 99, which is bronchophony.
99, 99, 99, 99, 99, 99.
And so now, every time you feel my stethoscope, if you will whisper the word 99, which is whisper practoriloquy. Okay, and now if you'll say the letter E, which is egophony.
E, 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 E.
Okay, so no evidence of consolidation is noted. We will now do the cardiac section. So I'm going to start off by listening with the diaphragm, aortic, pulmonic, Erb's point, tricuspid, mitral. And now with the bell, aortic, pulmonic, Erb's point, tricuspid, mitral. We'll now find the point of maximal intensity, which is going to be in the 5th intercostal space, mid-clavicular line. And we're going to auscultate there for a apical pulse for a full minute. And the pulse is 65 beats per minute. I'm now going to have you lay back, and we're going to repeat that exam with the diaphragm first. Aortic, pulmonic, Erb's point, tricuspid, mitral. And now with the bell, aortic, pulmonic, Erb's point, tricuspid, mitral. All right, I'm now and no abnormal heart sounds or murmurs were noted when she was sitting up or laying flat. S1, S2 were heard in both positions as well. I don't see any heaves or lifts. I'm now going to palpate for any thrills, okay? So aortic, pulmonic, Erb's point, tricuspid, mitral. No thrills were palpable. I'm going to have you look to the left and the right, and there's no jugular vein distension or jugular pulsation noted. I'm now, let's do the GI system. So abdomen is symmetric, flat, non-distended. I'm now going to auscultate. Okay, normal active in all 4 quadrants. I'm now listening to the aorta for any bruise, renal arteries, the iliac arteries, and the femoral arteries. Okay, and no bruise were noted. I'm now going to percuss. And I heard mainly tympany over all 4 quadrants with some dullness over solid organs. I'm now palpating for any masses or tenderness. In the right upper quadrant, we're palpating for the liver. She takes a deep breath in and out. I'm now palpating in the left upper quadrant for the spleen. The spleen's not palpable, any tenderness, so no masses or tenderness noted. I'm now going to have you sit up, and we'll do CVA tenderness. So I'm going to have you face that way just a little bit. Thank you. Any tenderness? All right, so no CVA tenderness noted. We are now going to move on to your joints. So we'll start with her hands, wrist, elbows, shoulders, hips, knees, ankles, toes. So no redness, deformities, swelling, nodules, crepitus, or tenderness noted. Next, we'll do your hands. So if you can do capillary refill first, and it's less than 3 seconds. And now I'll do your range of motion of your hands. So flexion, extension, hyperextension, abduction, adduction. And so full range of motion of the hands. And then strength was 5 out of 5 for her hands. And now her wrist, flexion, extension, hyperextension, ulnar deviation, radial deviation, rotation. So full range of motion of the wrist down to elbows. So flexion, extension, hyperextension, and then push against my hands. Now pull. So that's triceps and biceps. Strength is 5 out of 5. Full range of motion of the elbows. Now the shoulders. Flexion, extension, hyperextension, internal rotation, external rotation, abduction, adduction, and then I'm going to have you push against my hands. Now pull down against my hands. Now shrug. Okay. So full range of motion of the shoulder. of the shoulders, and strength is 5 out of 5, and cranial nerve 11, the accessory nerve is intact. Next, we'll do your neck range of motion, flexion, extension up, back, hyperextension, rotation side to side, and then lateral flexion, ear, shoulder, and 4 range of motion in the neck. Next, if you will close your eyes, every time you feel me touch you, you'll say here, okay?
Here, 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 here.
Okay, so light touch sensation is intact. We're now going to have you close your eyes for me and hold your hand out. Can you identify the object?
Paperclip.
Perfect. So, stereognosis stereognosis is intact. Now identify the number I'm drawing.
2.
Okay. Grasthesia is intact. I'm now going to have you put your hand out, and then I want you to tell me when you feel vibration.
No. No.
Okay. Move your feet apart a little bit.
No.
Okay. The vibratory sensation is intact. We're now going to do cerebellar coordination. If you could take your finger and touch my finger. Okay, now with the other hand. Okay, and now do finger opposition. Okay, and then rapid alternating motions. And so cerebellar coordination is intact. I'm going to go ahead, let's do thumb opposition. That was with the range of motion of the fingers. We will now do your feet. Oh, let's do deep tendon reflexes next. Okay. Okay. Okay, now that was brachial radialis. This is brachial. Okay, now this is triceps. Okay, now patellar. Okay, and then we'll do Achilles tendon, Achilles reflex, and then Babinski. Okay, and so deep tendon reflexes are intact. We will now do the toes. So capillary refill of the toes is less than 3 seconds. Your dorsalis pedis pulse and posterior tibialis is 2+ equal bilaterally. I'm now going to have you push against my hands. Now pull against my hands. So the strength of the ankles is 5 out of 5. Now let's do your toe range of motion. So flexion, extension, hyperextension, abduction, adduction, 4 range of motion of the toes. Now your ankles are going to be plantar flexion, dorsiflexion, inversion, eversion, rotation. So 4 range of motion of the ankles. Now let's do your knee strength, which is going to be pull against my hands, push against my hands. So strength is 5 out of 5 for the knees. Now your hips. I'm going to use this leg and push out against my hand. Now pull in. Same thing the other side. Push out, pull in. Hip strength is 5 out of 5. I'm going to have you stand up for me. Now let's do knee range of motion. So you're going to do flexion, extension, hyperextension. The other side, flexion, extension, hyperextension, 4 range of motion in the knees. Now your hips, you're going to do flexion, extension, hyperextension, and abduction, adduction, and then internal rotation, external rotation, circumduction. Same thing the other side, flexion, extension, hyperextension, abduction, adduction, internal rotation, external rotation, circumduction. 4 range of motion of the hips. We'll now do your spine. I'll have you lean forward for me. This is flexion of the spine. This spine has a present S-curve. It seems to be aligned. There's no signs or symptoms of scoliosis, no tenderness. Now I'm going to have you stand up. That's extension of the spine. Now lean back, hyperextension of the spine, lateral rotation side to side, and then rotation of the spine. 4 range of motion of the spine. I'm now going to have you close your eyes. She's Romberg negative because she doesn't lose her balance. I'm going to have you walk towards 4 steps. Regular gait has symmetric stride length with a normal gait. And now I'm going to do tandem gait, which is heel to toe. Just consistent contact between the heel and toe indicating appropriate tandem gait. I'm now going to have you hop in place. So one leg, now the other. All right, that was appropriate. And so that ends our physical assessment. Thank you.